basically OHCOW is a system of 7 clinics, and we have some sub-satellite offices across Ontario that grew really out of the labor movement with some of the people that were having difficulty with, WSIB claims and some of the struggles that we have, to have a worker-centered occupational health expertise that people can use as a resource. So if somebody, so OHCOW stands for the Occupational Health Clinics for Ontario Workers. And the first clinic was in Hamilton in the 1980s, and it grew into this system of 7 clinics across Ontario. I work in the Sudbury office. And OHCOW is basically, does work on prevention, but for individuals, if you have an injury or an illness that you think is related to your workplace duties or your workplace exposures, you can go to OHCOW and say, look, this is what I was doing in my life. Could this be the reason why I can't move my wrist, or why I'm hacking up all the time? And OHCOW has contract physicians. We have occupational health nurses, occupational hygienists that look at what kinds of things you're exposed to, what levels you were exposed to in your job. We have ergonomists that look at the kind of, musculoskeletal things that, carpal tunnel, stuff like that, and look at your job duties and stuff. And they will, look at that, basically give you an opinion. Yes, we think this is work related and this is why. They'll look at, what does the scientific literature say? What do studies say about these kinds of exposures? And they'll provide you with an opinion, often in a report, and then you can take that report and go off to make a WSIB claim, or if your claim is denied, again, we can take a look at it and say, why are they denying it? Are they saying that you don't have the disease that you say you have? And then we can have our physician take a look at your records, medical records and stuff like that. So that's basically what we do. And I know Jim's talked about other things with, going after the ministry or the people who did this. That would be a separate thing from OHCOW. What we're gathering for information would be for individually to look at your particular circumstances, but collectively, everyone adds that piece to the puzzle. Some of the things that you have to say, whether or not you're sick yourself, the workers who are alive and doing okay, or maybe not doing okay, but at least they're alive to tell the tale. The stuff that you give us and disclose, and it really paints a picture for those of us who, you could have families of workers, they don't have a clue what that worker went through at work. They don't have a clue what their situation was. If someone asked me, my father was an underground miner, and if somebody asked me what he did, what he was exposed to, what kinds of drill oil mists and stuff like that, I wouldn't be able to tell them. I have a much better clue now because I've been working at OHCOW and I'm absorbing like a sponge all of this wonderful expertise around me. So when, so OHCOW basically, when they're looking at a group of people that have different issues, it's really helpful to get a whole bunch of information from, in a structured way. We're asking you, specific questions, because we may come up with, health issues that are in this group that we're like, this is the third oral cancer that I've seen, or a very rare kind of a blood cancer or something. And though that's the benefit of having in as a group. So I just wanted to kind of paint that picture of, because I know there's lots of these acronyms that get thrown on. There's OHCOW, there's the Office of the Worker Advisor, or OWA. They're there to kind of help represent you for claims. Normally WSIB doesn't start the claim process or whatever, but we have been doing that a little bit with some of the group clusters, because we have 500 miners in the McIntyre Powder group, and 800 with the General Electric, and we have a large amount of people that they just need help, and a lot of them are elderly and health compromised, and so we're doing our best to help. We're a very small team associated with the projects, the projects meaning the occupational disease clusters, and there's far more of them than what we can reasonably help right now. So part of that is really we're trying to push for long-term multi-year funding instead of every 3 months having to justify the next 3 months, because it's very hard to get staff to stay when they're getting that. So I just want to give you a little bit of picture of what OHCOW is, just to get in your mind what we're trying to achieve. I came to OHCOW through my independent work as the founder of the McIntyre Powder Project. So McIntyre powder is just, I'll just do a very quick overview. It's finely ground aluminum dust that was brought into underground mines and some factories worldwide. Started at the Northern Ontario, started at McIntyre mine in Schumacher and Timmins, which is why it's named McIntyre powder. And the theory was that if you inhaled this aluminum dust, it would prevent the lung disease silicosis. So miners, they would take this finely ground aluminum dust, put it into canisters, puncture the canisters attached to compressed air lines. And every day before my dad went underground, he had to inhale, sit in a room, and for 10 minutes, inhale metal, inhale aluminum. This practice went on from 1943 to 1979. It was very widespread. And my dad ended up with Parkinson's. And I, as a layperson, was thinking, when I didn't know about, he never talked about the aluminum dust until 10 years after he had gotten Parkinson's. And so I did a WSAB claim back in 2011, and it was denied. And when I looked at it, WSAB had this very massive barrier. It was a policy that could automatically deny you if you were claiming a neurological disorder associated with occupational aluminum exposure. So we withdrew his claim in 2014, and then he just said they're never going to. You get so frustrated with WSAB, and he said, they're never going to approve this, and he was tired, and Parkinson's was wearing on him. But I just felt like there was other people out there, and I wanted that answer. So he gave me his blessing to tell his story. I did research for a year, and then I went public in 2015, and I started a voluntary registry, which is something akin to what you're doing here. Is you're basically saying how many people are out here, what kinds of health issues do you have, and then you can start to see trends. And I was starting to see enough Parkinson's cases pile up, and some ALS cases, sarcoidosis, which I'd never heard of until I started this. And that there was a bunch of media stories, and that gained the interest of, labor helped out the United Steelworkers, because these are a lot of their members. The occupational health clinics came on board. Dave Wilkin was one of the first people that I spoke to about this, and he's been phenomenal. He has a lot on his plate, so it's hard to imagine how he manages all of this. But that's what ended up. It was the impetus. It was we had enough weight to say, look, we've got X number of miners here, and 10% of them have Parkinson's and whatever. So long story short, WSAB ordered a study from the Occupational Cancer Research Center that compared neurological disease rates in miners who got McIntyre versus miners who didn't, versus the general population of Ontario. And they found a statistically significant link between Parkinson's and McIntyre powder. And now it has become, instead of having this policy that automatically bans it, we found out this week that it is been added to the presumptive schedules of the Workplace Safety and Insurance Act's regulations, meaning that if you were exposed to McIntyre powder and you got Parkinson's, it's automatically presumed that your workplace caused that. So it is a long road to get here. And I understand if you're going into it, you don't have to wait for OHCOW to file a WSAB claim. You can file a WSAB claim for anything that you think might be work related. You can do that. But the benefit of having this group format is that you can start to see trends that you wouldn't otherwise see on individual claims. And right now, is WSAB is the one that sees those trends, because they're the ones getting all these individual claims from these people who live maybe across the country. And this way we have some bird's eye view in there saying, no, we're seeing this many trends here. This is an issue. And then as Dave was trying to explain, once we have that big bowl of information as a group, we start looking through, compiling it, and the administration work is massive. It took us we had intake clinics in 2016 for the McIntyre Powder Project miners up in Timmins and Sudbury. And it took us several years to gather all the information to supporting documents. So going through 500 files and, that have people attached to those files and names and people waiting for help. We're trying to gather medical information, trying to gather workplace information, and it's a lot. But when you have that, you have a very rich whole of information that we can then pull out trends that we're seeing and say, okay, maybe this is related to the RB4 exposures. Maybe it's related to the rest of the kinds of work that you've done. McIntyre powder is not the only thing we look at. We look at, silica dust and diesel exhaust exposure and a bunch of other things like that. So, so individually, we will eventually get to all of your files, all of your individual circumstances, but collectively it helps to, with McIntyre powder, we basically sat down and said, okay, what kinds of diseases are there in mining? COPD is there, other lung issues. And then we looked at those and said, okay, let's encourage all of these workers to put in claims for this, because even if we don't know that McIntyre powder is the reason, there's other things in their work environment that could do that. So that's kind of the benefit of that. And it takes a long time. It's very frustrating. It's frustrating for us. We want to help everybody, and we kind of jump a little bit between the different groups. I'm not as involved on Dryden as I am in some of the other clusters at times. And then when they need help, we just kind of shift over as best as we can. I believe in this kind of work, and I'm working for OHCOW gratefully because I believe in it. It's not quick, but it's, we try and gather this information while people are alive and able to give it. And I've lost more than 50 miners on my voluntary registry since I started it in 2015. And, if we hadn't gathered this information, we'd never have it.